Secretary Allen, thanks for being with us this morning. I know this campaign has some political connotations, so I want to know who's paying for it and how much it's costing.
Yeah, the campaign's about $400,000 for 4 weeks that we're running it. And it's a mix of state and federal dollars, grant programs, those kinds of things. It's all around healthcare workforce.
Is this more of an effort to actually recruit healthcare workers to New Mexico, or is it an effort to sort of slam some of the conservative stances that Texas has taken when it comes to abortion and gender affirming care?
Oh, it's absolutely about recruiting healthcare workers. New Mexico, like lots of other states, has a healthcare workforce shortage. And so we're always looking for any advantage we can find to try to attract more providers. We think Texas and states like it have created a political and legal dynamic that creates lots of uncertainty, questions, potentially fear for providers. And I can't think why we wouldn't take advantage of that circumstance in that fight to try to recruit providers.
You mentioned Texas. Are you looking at taking this to other states?
Well, right now we're trying this out in Texas. It's a brand new kind of an approach for us. We've not done it before. We think Texas provides a good place to try it out. We think the legal and political dynamic is pretty strikingly different there than it is in New Mexico. It's also a Southwest state, and so we don't think it's such a leap for people to consider New Mexico as an alternative. We're going to assess the effectiveness of the campaign, and we may go longer in Texas. We may expand to other states, or we may decide that it was something interesting worth trying, but that didn't necessarily work out.
How do you think you'll be measuring success?
Well, we're going to do a couple of things. We're going to use the standard marketing metrics around click-throughs to the website and impressions from our digital marketing and those kinds of things. And then we're up to about 120 different providers across New Mexico who have provided job openings to our website, and we'll be looping back with them to basically see what they think the effectiveness has been in terms of trying to attract candidates to their jobs.
Have you seen any hard evidence of an impact on the healthcare system in New Mexico from patients who are leaving Texas because they don't have access to things like abortion or gender affirming care?
Oh, sure. In terms of abortion services, we provide a huge amount of service to Texans. I think the most recent numbers are something on the order of about 14,000 abortions per year that are provided to Texans. And so it's been a massive change in the pattern of that level of care. But we can also see changes in things like gender affirming care, broader reproductive health. I think one of the biggest concern areas really is around miscarriage care. And that really is not something that you plan and expect to travel for. That's something that happens as an emergency. And so, I think you're seeing in Texas already a significant drop in people signing up for OBGYN residencies and those kinds of things. So I think there's a complex dynamic around care providers and people seeking care around what the actual day-to-day implications of the policy and legal changes have been.
Do you feel like it's putting a burden on the New Mexico state providers?
I think there have been changes in the pattern of providers. I think early on, a little bit after Senate Bill 8 in Texas, and certainly after Dobbs, there was some challenge with waiting times and those kinds of things. I think specifically for abortion care, that has smoothed out a bit, and we're not seeing that kind of a dynamic. But we're a state that needs more of everything everywhere in terms of providers, and so again, we're trying to make a pitch to providers in Texas that they don't need to look over their shoulder and worry about a DA or a sheriff second guessing their medical judgment.
New Mexico, like many other states, does have a doctor shortage. I know we face it here in Texas. Many states across the country do as well. How did things get so bad?
Oh gosh, that's a great question that I don't think anybody has any definitive answers to. I think a couple of things is we've got some population dynamics with the aging of the baby boom generation. I think through the pandemic there was sort of a whole at one point we called it the Great Resignation. I think that maybe was an oversimplification, but I think in a lot of the caregiving industries, whether it's healthcare, long-term care, childcare even, there were a lot of people who looked at the economics of what they were doing and basically said, I'm just not going to do this anymore. I'm going to go do something different. And I think we're still recalibrating a lot of that. I think also there's, as much as we've all been making investments in healthcare education, I think we need to do a lot more. And, probably there's some element of immigration policy that gets into it as well in terms of where all we attract providers from.
Well, we will be interested to see how this campaign turns out. Secretary Patrick Allen, thanks for your time this morning.
Thanks for having me.